Welcome back for this third class of the week. So, last two classes we initiated with the basics of biosensor development, and I'll just do a bit of a recap for you guys. So, we talked about the world of electrochemical biosensors or bioelectrochemical sensors. We talked about the time, simplicity, sensitivity, rapid response for clinical sample, and point of care sensors or point of care devices. Then we talked about the definition of electrochemical biosensors. Then we talked about the usage in environmental monitoring, healthcare and biological analysis. Then we talked about the two broad type affinity sensors using antibody like molecules, nucleic acids, nanobodies, and the biocatalytic devices. Thereafter, we moved to first biosensor of Clark and Lyon in 1962 using glucose oxidase. Then we talked about the basic chemistry of glucose oxidase, where it's an enzymatic biosensor where oxygen is getting reduced to hydrogen peroxide, but then hydrogen peroxide by applied voltage of 0.7 volt is converted into oxygen. So, this oxidation reduction, and during that process there will be two electrons and two protons which are generated. These two electrons could be quantified, and you can understand how much glucose is getting consumed in the process or how much glucose is present. Then we talked about the first electrode system and the second electrode system. Then we talked about the basic architecture of glucose sensor, enzymatic amperometric method. It's amperometric because you are measuring the amount of current. Then we talked about the basic of the generation 1 glucose biosensors, then YS123A glucose biosensors from the historical perspective, and the theory of it, and what are the challenges of the first generation biosensors, especially the heavy cost of platinum, 0.7 volt is the high potential what we are offering to it, leading to degradation of other compounds which causes interference. Now we move to the second generation of glucose sensors. So, cost prohibitiveness and interfering molecules and lack of sensitivity demanded further improvement. The second generation of biosensors, with this latter consideration in mind, the maturation of the field of surface chemistry. This is the time when surface chemistry was gearing up with XPS screen printing technologies from the world of microelectronics, semiconductor integration technologies again from the microelectronics world, combined with the use of synthetic electron acceptor. This is one important point. Synthetic electron acceptors. So, you could chemically synthesize these electron acceptors, resulted in major advances in development and commercial electrochemical glucose sensors. Synthetic electron acceptor in form of redox couple or mediator able to shuttle electrons between the redox center of the enzyme and the surface of the electrode. So, here I will spend some time to make you understand the challenge. So, let us go back to the reaction and see exactly what is happening. So, I'll pick up this picture. Now, think of this situation. Here you have the glucose oxidase enzyme. Okay. Now, whatever reactions are happening, they are happening inside the pocket of it, of this enzyme. So, inside the pocket, first of all, oxygen has to reach inside the pocket, and once the oxygen, and of course, the glucose has to reach inside the pocket. So, when you talk about the pocket, let us assume this is structure. Assume this is glucose oxidase enzyme, and so the glucose has to enter into the core of it where the electron transfer is going to happen, and oxygen has to get into the core. Once these two are inside the core of that enzyme, mind it, then this fabulous reaction is going to occur where glucose plus oxygen in the core of glucose oxidase leading to gluconic acid and peroxide. Now, the fact is, if you have to measure this kind of electron movement, then your electrode should be very close to that site. But now think of it, you have most of the electrodes are flat electrodes, and you have something like this, where the reaction is happening deep inside the pocket of it. So, automatically your electron sensitivity will be less, because it is a three-dimensional thing. And this is something you have to imagine, that the reaction is happening at the core of the molecule. So, thus many inorganic redox couple and organic dyes have been successfully deployed in order to shuttle electron for the reaction of glucose catalysis by glucose oxidase. So, that means there should be some smaller molecule which could, say for example, penetrates there into the core of it, which you call as electron shuttle. And this shuttle picks up the electron and brings it on the electrode surface. And these shuttles or synthetic electron acceptors is what changed or led to what we termed as the second generation of glucose sensor. And these are very beautiful molecules which could, pull the electron from any nook and corner of a three-dimensional structure, right. Thus, many inorganic redox couple and organic dyes have been successfully deployed in order to shuttle electron for the reaction of glucose catalysis by glucose oxidase. Furthermore, it was shown that this method was efficient at lower applied potential, thus provided decreased interference effect while also being insensitive to the dissolved oxygen concentration. So, if you remember, in the last class we talked about 0.7 volt, which is a pretty high potential, which leads to degeneration of unwanted species or interfering species. In this situation, that is not that voltage could be brought down because of the presence of this synthetic shuttles which are there. Now, for these reasons, in 1984, the first mediated amperometric biosensors towards glucose was reported. Meanwhile, the screen printing technologies were being adapted for the production of disposable. So, here is the era of beginning of the era of disposable biosensors. Specifically, we are talking about glucose at this point. Small or miniaturized, robust and cheap electrodes for amperometric biosensors. These two innovation research initiatives gave rise to the first very successful home use blood glucose biosensor based on mediators and screen printed electrodes. These are, we are talking about electron mediators and screen printed electrode. In 1987, these biosensors were launched under the brand name of Exactech by the medicines company originally named Genetics International, which was a company founded between universities of Cranfield and Oxford. This was the second generation's rise, 1984. So, if you look at the first generation was 1970s, starting from 1962, 70 and goes till 1980. Second generation started with 1984 onward. Now, substrate, product, and here you have some mediator which is taking care of this reaction. Those mediators are one of the major landmark in the process apart from screen printed electrodes. Now, this brings us to a point. This lasted for a while, but then there was a need for the third generation. And what is that third generation? We will talk now. Still, the challenge remained significantly the varying or modification of enzymes. It's a beautiful concept. So, basically what you are trying to say is that if this is my enzyme and in this core I have a reaction happening, I should wet the whole enzyme in such a way any electrode reaction happening, any electron generating could be funneled out. What I was showing in the previous section, you should be able to funnel it out. But then that needs enormous amount of chemical modification of the enzyme itself in order to integrate a molecular wear. The whole concept brings us to molecular wears transferring electrons towards the third generation glucose biosensors. Even with the enormous success of the commercially mediated glucose biosensors, the nature of the biochemical structure of glucose oxidase enzyme, the relative solubility and toxicity of the mediators. So, when we talk about this synthetic mediators, they lead to reasonable amount of toxicity. So, this is where we were based on mediators. The whole concept of mediator I have already talked to you. So, the overall poor stability of this mediator system, poor stability and toxic towards extended continuous operation led the researcher to concentrate on sensors based on direct electron transfer between the enzyme redox center and the electrode. How we could make that direct? The flavin redox center of the enzyme cofactor, which is deeply buried in an electrically insulated thick protein shell, is incapable of achieving an electrical connection with the electrode surface. So, basically the problem is that the direct electrical contact with the enzyme's reaction center is challenging. It is challenging because the direct electron transfer between enzyme redox center and the electrode, the flavin redox center of the enzyme cofactor, which is deeply buried in an electrically insulated thick protein shell, is incapable of achieving an electrical connection with the electrode surface. Thus, minimization of the electron transfer distance is vital in order to ensure performance of the sensor. This is a molecular structural challenge. Now, Heller's group, this is one of the groups which made one very beautiful progress, reported one of the first smart routes of establishing this communication between glucose oxidase active site and the electrode using a long flexible polyvinyl pyridine PVP. These are those molecular wears or polyvinyl imidazole polymer backbone, which had a dense array of linked osmium complex electron relays. This was a breakthrough where you really could access the electron transfer site of the enzyme itself, and that changed or altered the game in a very unique manner. In this way, the redox polymer penetrates and binds the enzyme and forms a three-dimensional network. This immobilization process, wearing the enzyme to the surface, significantly decreases the distance between both redox center of both polymer matrix and the enzyme. Due to the permeable nature of the applied polymer, glucose and the product of the reaction are easily transferred between the matrix and the electrode. So, it is a very unique solution using a molecular wear able to reach to the active site where the real electron transfer is happening and pulling the signal from that. So, that means we are talking about extremely small flexible electrodes. This is what we are talking about, extremely small electrodes which could penetrate. So, these was the time which today we all know is what we call as the molecular wares. These are conducting wares, these are conducting molecules which are getting into that site and pulling the signal from there. Right? Now, similarly, another attractive route to facilitate electron transfer between glucose oxidase redox center and the electrode surface is chemical modification of the enzyme itself. This was the other route which was followed. What was that route? 1987. 84, we remember the second generation was culminating. 87, Degani and Heller demonstrated the covalent attachment of ferrocene carboxylic acid. These are pretty interesting electron transfer molecule, ferrocene carboxylic acid, to the glucose oxidase by a carbodamide chemistry when a sufficient amount of covalent attachment to the ferrocene carboxylic acid molecule to the enzyme was achieved, and enhanced electrical communication was obtained between the redox center of the enzyme and the electrode, which is gold, platinum or carbon. So, as soon as it's a carbon electrode, the game is on, because this is the future. This is where you have economical, sustainable biosensors are taking birth. Now, these are those unique breakthroughs which are changing the third generation. Then came 1995, where Wilner's group reported a highly elegant approach to improve the electrical contact by treating the glucose oxidase with electron relays. In this study, the redox center of the glucose oxidase, which is FAD, flavin adenine dinucleotide, what we talked about earlier, that FAD site, was removed and modified with a ferrocene. This was followed by the reconstruction of the APO enzyme with ferrocene modified FAD. So, the Wilner work and Heller's work set the tone for the third generation of glucose sensors. And we will talk a little bit more after this, when we will talk about how nanotechnology soon after that, this was the 90s era, got into this whole thing and how this completely transforming, especially when we talk about point of care glucose sensors and miniaturization. And further, so far we have only talked about enzymatic ones, right? Enzymatic glucose sensors. Hereafter, we will also talk about non-enzymatic glucose sensors. So, the very moment it becomes non-enzymatic, there is a huge reduction in the cost, because you do not need that pure glucose oxidase anymore. You can detect it with inorganic system. So, apart from it, we will talk about the market of these kind of sensors, that will help you to appreciate the last week insulin story. It's kind of an extension of the insulin story, how we are identifying glucose and why it is so important, specifically considering the fact that India is the diabetes capital of the world. This glucose sensor market is evolving. So, if you look at it, 60 years, modifications, certain modification, improvements or improvement. We started with a simple reaction. If you recollect, we started with simple reaction, glucose plus oxygen making gluconic acid and peroxide, right? But then from there, so the first sensor was how much oxygen is getting consumed in oxidizing glucose is what is being quantified by the Clark's electrode. From there, we reach this far, and this is how the development happens. Now, Willner work said that you can completely wear the enzyme, and these are the beginning of understanding electron transport chains, how the electrons are hopping from one point to another. So, I will close in here, and the next class we will talk more about the enzymatic and a non-enzymatic glucose sensor and the market, why these sensors are getting so popular. And in that process, we will introduce more into the architecture, which possibly will spill over to the next week when we will talk about the architecture of these sensors, what exact reactions happening on the cathode and the anode, what we really meant by polarimetry, what is this applied voltage concept. So, we will talk about all these different concepts. Thank you.